This briefing was organized in response to Congressional Office's interest in this topic, and specifically, we partnered with the Congressional Victims' Rights Caucus to coordinate this event. I want to mention our other key collaborators before we move into the content of the program. They include Pennsylvania State University's Center for Healthy Children and the Global Alliance for Behavioral Health and Social Justice. Our primary sponsors for this afternoon's briefing are the Society for the Psychological Study of Social Issues and the National Prevention Science Coalition. I want to quickly mention that we're going to have an evaluation forum. All of the folks that were involved in putting this together are very much interested in your feedback as we move forward on these issues after today. So I encourage you to pick one of those up and fill it out at the end of our briefing or when you leave. So, as Representative Poe mentioned, addressing the problem of human trafficking is challenging. It's not impossible, but it's challenging because it encompasses a range of circumstances, it often overlaps with related crimes, and it can be difficult to measure. We have to consider how factors at the individual, interpersonal, institutional, community, and societal levels all contribute to human trafficking, and all could potentially be targeted for intervention. So there is a need for a multi-tiered strategy that better assesses risk and protection, provides an array of services to meet the unique needs of victims and survivors, and reduces the vulnerability of children and youth to trafficking. While we have made progress, researchers and others have noted that the current responses that we have often address the symptoms and not the underlying structural and systemic causes of human trafficking. Many of the programs in the U.S., which are incredibly important, focused on the response, as the representative was saying, to victims and survivors of human trafficking. By contrast, preventive approaches, when they are present, can in part focus on strengthening vulnerable and at-risk children, increasing their resilience to becoming victims. As noted by the U.S. Department of State and others, the fundamental framework used by the U.S. and others includes what's called the 4 Ps: prevention, protection, prosecution and partnership, and program evaluation. Today, in this briefing, we're going to focus on the lessons learned from the growing research base on the first of those 4 Ps, prevention. We know that the limited evidence base could and should be strengthened through rigorous evaluation of promising prevention and intervention practices that we're going to be discussing today. So it's my pleasure now to turn and to introduce a panelist of experts who are going to be speaking today. I'm going to introduce each one in turn, and we will have time for a few questions and answers after each panelist, and then hopefully we'll have some time at the end as well for questions and answers. So I first want to start by introducing Dr. Joan Reed. She's full-time faculty at the University of South Florida at St. Petersburg. She's a practitioner researcher with expertise on human trafficking of minors in the United States. She has over 30 research publications as well as extensive community involvement in combating human trafficking at the grassroots level as a mental health counselor and victim advocate. Dr. Reed?
Thank you for taking time to discuss this important issue. My slides are going to be up there, and you also have them in your handout. Well, that's not my slides. There we go. Okay. All right. So the reason I'm here is to talk about prevention of human trafficking. In my research on human trafficking of adolescents in the United States, I have found that 70% of boys who are trafficked are repeatedly exploited, and 90% of girls who are trafficked are repeatedly exploited. And so when we think about the detrimental impacts of repeated exploitation and human trafficking, it becomes critically important, prevention becomes critically important. So the vulnerability is the first step in the human trafficking entrapment process. And vulnerability can occur at each of these areas. And the challenge of prevention, sorry, the slides are moving on their own. So the challenge of prevention is that we have to talk about vulnerabilities at each of the levels: individual, interpersonal, community, and societal levels. So first we'll talk about the individual vulnerabilities. So human traffickers seek out individuals who are easy to manipulate and who have no one looking out for them. For instance, individuals who are from another culture, from another country, who speak a different language. Traffickers find these individuals easier to isolate and to exploit. In the same way, traffickers target younger victims. Due to inexperience and naivety, minors are especially susceptible to coercion and entrapment. A convicted sex trafficker was quoted as stating, "With girls, you promise them heaven and they'll follow you to hell." These vulnerabilities are almost assuredly compounded by emotional and intellectual disabilities. In my research, I found that 30% of trafficked girls in Florida had an intellectual disability. One 15-year-old girl with an intellectual disability was reportedly sexually exploited by more than 400 men. And due to her intellectual disability, she was not able to comprehend even the difference between a boyfriend and a John. Also, the majority of trafficked youth in my research samples have been diagnosed with a mental health disorder. Many have been diagnosed with more than one disorder. Alcohol and substance use also create vulnerability to exploitation in various ways. For example, addiction to drugs can create an avenue for exploitation by human traffickers. Homelessness, running away, unsupervised use of social networks by teens, they each create a vulnerability by giving traffickers easy access to vulnerable persons. So then we'll move on to interpersonal vulnerabilities, and these, it's interesting that these are common among both domestic and international victims of trafficking, and they include family adversity, caregiver mental health and substance use issues, having a family member, a peer, or a romantic partner that's involved in trafficking or directly complicit in recruitment into trafficking. Also financial pressure. So either from the need to support a family member who's maybe lost their employment or actually to support their own child. These pressures have been linked to exploitation by human traffickers. Threatening to take or harm a child is a common strategy used by traffickers to gain victim compliance to trafficker demands. Family violence is one of the many forms of child maltreatment that has been linked to exploitation and human trafficking. In my research on trafficked boys and girls in Florida, over 90% had experienced family violence. Children and adolescents who experience family violence will run away from that violence, leading them to the streets where they're at elevated risk for exploitation. Where did we go? Sorry about that. All right, so also in research on trafficked boys and girls, the majority have experienced sexual abuse. Many have experienced physical abuse or neglect and abandonment. When we talk about sexual abuse, often we think about girls and this impacting girls, but in my research on childhood adversity and human trafficking, I found that boys who had been sexually abused were 8 times more likely to be exploited in human trafficking than boys similar boys without a history of sexual abuse. So also researchers have found that LGBTQ youth and youth in foster care or living in group homes are at disproportionate risk for exploitation and human trafficking. It bears repeating that human traffickers seek out individuals who are easy to manipulate and who have no one looking out for them. And this often describes boys and girls in foster care and living in group homes where there's a high child-to-adult ratio. For those trafficked from other countries, having an expired visa or a visa that's actually supported by a trafficker increases their vulnerability to exploitation. So at this point, we've reviewed many of the individual and interpersonal vulnerabilities that are most often noted by researchers of human trafficking. However, experiencing one of these types of vulnerabilities does not necessarily equal or explain exploitation and human trafficking. Instead, we've noticed that these vulnerabilities often compound and cluster. And so the research project that I'm working on at this time was to detect vulnerability profiles. And so using a rather large sample of over 900 trafficked youth in Florida, my colleagues and I were able to analytically identify 6 vulnerability profiles. So the first profile comprised 25% of the sample, and it's probably the most recognized profile among U.S. domestic minor sex trafficking victims, and this is a runaway, maltreated youth who's in foster care, who is engaging in health risk behaviors such as drug use and alcohol use. However, if we add 2 more of the profiles, which also comprise 25% of the sample, we'll see that there was one profile that had no involvement in foster care. And so if we only target prevention at those in foster care, we're going to miss this group of youth. About that. And also there was a similar profile, but they had little involvement in drug use or alcohol use. Then when I added, these are the last 3 profiles, which comprised the 50%, almost 50% of the sample, and we'll see that they had a low likelihood of sexual abuse or physical abuse, and some had drug use and some did not. So the takeaway message from this research is that more youth are vulnerable to human trafficking than we had originally conceptualized. And many who are at risk may be being overlooked, ignored, and not warned about the potential danger of sex trafficking and human trafficking. So families and individuals live within communities, and researchers have investigated what community features raise the likelihood of human trafficking occurring in those neighborhoods or communities. And one of the first vulnerabilities is neighborhood crime, particularly prostitution and drug problems, because often traffickers will segue into the sex trade from the drug trade. Also, some family members who are addicted to drugs will sometimes sell their children in order to support their drug habit, or teens who are using and selling drugs will sometimes resort to selling sex and be exploited in that way. Also, organized crime or groups lead to facilitate human trafficking in their area. So often these groups will work together, be organized, have facilitators, recruiters, and other traffickers that they all organize together. The second community feature is having transient populations or areas. And so neighborhoods or communities that have high levels of tourism, sex tourism, a lot of conventions, they have truck stops, airports, international border areas. These are areas where there could be higher demand for human trafficking, and also these are areas where it's easier to transport victims to. And the last community feature is an economy that's reliant on the sex industry or seasonal workers, has high rates of poverty and limited employment and career opportunities. And these things all create vulnerability to human trafficking. So beyond features of communities, there's also the community response or lack of safeguards that increase vulnerability to human trafficking. And within the criminal justice system, if police do not have adequate training, often the victims are the ones who are arrested, and the traffickers are not arrested. They're able to go out and find and exploit new victims. Often there's limited prosecution of human trafficking cases. According to research, often when a human trafficking case is identified and referred to prosecution, few are prosecuted under existing human trafficking laws, and instead the cases are dismissed or prosecuted with lesser crimes like pandering, promoting prostitution, or alien harboring. And the result of this is that the population and the public do not know the prevalence of human trafficking in their area, and it also sends a message to victims and offenders that these cases aren't very serious. Also, service providers often don't have the training they need to be able to identify potential victims of human trafficking and to respond to victims. Child protective workers, medical professionals often interact with victims of human trafficking before they're victims of human trafficking, but they're not yet trained to be able to identify those potential victims. And often within these communities, the most vulnerable persons have the weakest social safety net. So young mothers, youth with disabilities, they often have the lowest level of social services. And often there's also inadequate protective strategies, often group homes which house youth with disabilities or foster children are in very high crime areas where traffickers are operating, and so they have easy access to these very vulnerable individuals. Also, there's a lack of information regarding human trafficking that could safeguard potential victims. Research has found that peers can be very helpful with prevention, yet if peers are not aware of what the red flags are, what are the signs of human trafficking, they're not able to assist a friend or refer them for help. And also, as a society, there are certain societal beliefs that make us more tolerant of human trafficking. I don't know if you've noticed or not, but pimp has become a very favorable word, a very positive verb. However, positive portrayals of pimps are not harmless. And also, in the same way that rape victims are often blamed for the crime that's committed against them by if they were drinking at a party, if they were wearing a skirt. Trafficking victims are often blamed when we ask questions like, was he illegal or did she ever use drugs? And victim blaming perpetuates the myth that a victim needs to be perfect in order to be worthy of protection, empathy, and care. But who of us is perfect? Also, as I've said before, human traffickers seek out people who no one's looking out for. They don't have anyone looking out for them. And when, as a society, we devalue certain people, such as women, children, LGBT youth, youth with disabilities, then we create vulnerability for them. So prevention begins by deciding that no form of human trafficking is tolerable and that all deserve protection.